Research shows women in the U.S. make the majority of healthcare decisions for their families, but often overlook their own health.
Sara Maslar-Donar sits down with a doctor at SSM Health who explains how women can make healthcare a priority.
Dr. Jennifer Krupp is with me now for this segment of Wellness Wednesday. She is the medical director of SSM Health's Women's and Newborns program. Thanks for being with us, Dr. Krupp.
Thank you for inviting me.
Of course. So for a lot of busy women, it almost feels like you don't even have a couple minutes to breathe, let alone go to a doctor's appointment. But it is important to do this. So can you talk a little bit about why you need to prioritize self-care when it comes to your health?
There are many reasons why it's important, and this isn't just, a lot of times we'll focus on women who have children where they're taking care of their children and they're just too busy. But we also have women who have careers and they just don't make time, and maybe they don't have children. But in order to really make sure that you're staying as healthy as you need to, or finding any problems that you may be having early so they can be treated so they don't go on to cause long-term problems, it's really important to at least see not just OBGYN provider, but also your family medicine or internal medicine provider for at least yearly checkups. And those are things looking at blood pressures, blood glucose, depending on your age, pap smears, mammograms. There's lots of screenings that should be done to catch diseases and so that we can prevent those from happening.
And these screenings and appointments, they kind of are yearly, or they have to be done when you reach a certain age. Can you talk a little bit about how that healthcare changes as we age?
Sure. So typically, and just speaking as a women's health provider, when we think about teenage girls, there are things that we talk to them about. We talk to them about being in relationships and being sexually active, if that's what they choose to do, how they can protect themselves. We talked about any symptoms that they might be having. And then when women get to be, 21 years old, that's when we start talking about cervical cancer screening. And that cervical cancer screening in a 21-year-old to a 29-year-old, it may be a little bit different than once you're 30 years old or once you're 60 years old. So it changes depending on your age, and it also changes depending on your risk.
And so what are some of the issues that women should be talking about with their healthcare providers? We've touched on a few of them, but are there additional ones?
So when they come in for their annual visits, because some of the screenings are only recommended every 2 years or every 5 years, things like that, but we still recommend that women come in every year. And at that visit, you can talk about things like incontinence or menopause, depression, just anything that might be going on, because there are treatments for some of those things and you don't just have to live with them. I know for a really long time it was, well, this is just the way it is. We have to live with these things. But there are a lot of things that we can do and offer. We have a pelvic health program at SSM Health that really looks at incontinence symptoms and things like that, and talks to patients about, here are all your options for how we can help care for this. We have generalists who specialize in things like menopause who can really help women so that they have a better quality of life as they're getting those symptoms.
And what do you say to women who might think, oh, whatever I'm suffering, it's so small, who cares, whatever? What do you say to women who don't want to talk about those things, who don't think they're a big deal?
So I think if it's affecting your quality of life and you're noticing as a problem, don't explain it away. Go in and talk to people about it so that you can get some help and you can continue to do the things you want to do and not let this get in your way.
All right, Dr. Krupp, thank you so much for this information.
You're welcome.